Let me teach you about how label thinking works. Label thinking works is that you take some signs and symptoms. A patient comes in and they say, I have this particular complaint. I have this particular issue, and on exam you find a particular set of findings. And you run some labs and some imaging studies, and you're certain that you have enough data in about that patient. You're using the data to ascribe a label to it. The label has a fancy name in medicine because we can't charge as much if we call it a label, so we're going to call it a diagnosis, okay? The diagnosis is a label. It's a name of something that's there. Now, we do this for one reason, and one reason only, which is to eventually come up with a particular treatment. So we're going to use a pill, potion, powder, or lotion, which is coming off of something called a formulary. It's a list. If you have this label, you look at where the label is on this list, and you have the best thing to do, the second best thing, and the third best thing to do. And although it sounds very formulaic, very rote, there is very much what's called a standard of care, which ascribes for every single set of signs and symptoms, there's a label, and for every label, there's something that you do, and there's one more thing to tack onto it, which is you put an ICD code on it, which helps you to get paid. That completes the entire medical paradigm of label thinking. And if you happen to be caught in this and not getting better, it really stinks, because you get the label, but you don't sometimes feel any better, and you feel a little caught because the label goes to a certain type of practitioner, and if that practitioner can't help you in the purview that they're looking at, you're kind of a bit stuck. You've gone to the very bottom of the granularity of medicine without getting anything for it.